Welcome to Mental Health Monday. My name is Mick Coyle. Coming up on the programme this week.
You just battle on, don't you? And then suddenly you completely crash. And if you'd known what the signs were to look out before, that would have added to getting some help and seeking some support.
If you asked any person on the street, what is the number one reason why people took time off work in the year 2020, 2021? Everybody would say COVID. Everybody would guess it must have been COVID.
When I say absence costs the UK billions, what about the other issues that are actually still going in the workplace? You need to add all of that in as well. And it's just this huge, massive problem we're just not doing enough for.
And I'll be reminding you how you can make connections with mental health organisations within your community. It's Mental Health Monday. The home of the UK's conversation about mental health. It's Mental Health Monday. It's 2022 and a chilly start to the year. I do hope you're well. Thank you for joining us. Welcome to everyone who's joining us from the Mental Health Monday Facebook group, and also new followers who are looking for new podcasts. Maybe you got yourself a new phone and you wanted to subscribe to some new services for this year. Mental Health Monday is available wherever you get your podcasts. Really fascinating show for you once again. And actually, if you work for or run a business, this week's edition is going to be, I'm going to say, absolutely essential. Listen right the way through, because there's lots in there about staff absences and people needing time off work because of mental health problems. A little bit of housekeeping though before we crack on with this week's show, because I got a lovely email through from the team at the Liverpool City Region Culture and Creativity Awards. I'm delighted to say that our Mental Health Monday Iron Men project, which we did on the beach of Crosby, to represent the positivity around men talking about their suicidal thoughts, coming through, finding services and coming through the other end, has been nominated for an award in the health and well-being category. So that's really fantastic news, and it's always great to get some recognition for what we're trying to do here at Mental Health Monday. And of course, recognition as well for those brilliant services that are out there too. So a great little nomination at the start of the year for an award. I'll let you know how we crack on with that a little bit later on the year. I think it's early March. There's an award ceremony for that. So fingers crossed things are looking good. Also worth mentioning as well, dare I say it, we've had another birthday. Mental Health Monday is now 5 years old. We started on the 9th of January 2017, episode 1 with Luciana Berger, and 5 years later we are still going. 5 years, more than 200 odd episodes, 24-hour shows, world firsts. We've done the lot here on Mental Health Monday, and that continues right here on the home of the UK's conversation about mental health. So I wanted to note that down as well. Thank you for people for sharing their warm comments about our anniversary or birthday on social media. Do get involved on social media, hashtag with Mental Health Monday where you can. I mentioned this week's programme is a really fascinating one, particularly for anyone who works in a business, works in an office, who runs their own business or office, because believe it or not, the number one cause for staff absences in the UK in 2021 was not coronavirus, was not COVID-19. It was mental health problems within the workplace. Now, this week we're teaming up with GoodShape, who've got a new report. It's called the UK PLC 2021 Workforce Health Report. And it looks at millions and millions of days off and absences over the course of the year, January to the end of November. And what it does is it works out what the reason was for the time off, the amount of time taken off, and then the lost days associated with that. Now, mental health issues were the number one cause. 19% of all lost working time across the country is because of mental health. Now, that's versus 16% for COVID. Now, I think most people would presume that COVID was number one for 2021. Not the case. Mental health problems within the workplace still a huge issue. And that's just the start of the stats and the story around mental health within a workplace and outside the workplace as well. For mental health issues, the average length of time taken off by staff was around 19 days in 2021. Now, for COVID cases, confirmed cases of COVID, it was actually on average only 6 days. That versus things around muscle pains and things like that, 11 days. You've got things like cardiovascular problems, stomach problems. That's a number of days as well. But the number one cause of staff absences in 2021, and then the longest reason for staff to be off, of 19 days within that top 5 as well, mental health problems just gives you a sense of the problems that organizations are facing on a daily basis, the costs associated with that. But of course, we've got to focus on the human impact. People who are going into work every single day who are struggling, who are then having to turn to their boss and say, I can't come in today because I'm struggling. It's about having a platform to have those conversations before they become a problem. It's about structures being in place that workplaces can then say, you know what, we've actually got a strategy for you, we can help you out, and we can hopefully get you back into that workplace sooner rather than later. Mental health risks will always be there within a workplace, but actually, just like you've got a first aider within a workplace, everyone needs to be able to rely on their own boss or manager, a friend or colleague within a workplace environment to turn to if they need to talk about their mental health. Let's have a chat this week with Suzanne Marshall, who's from GoodShape, who put the report together. She's their clinical governance officer. She's also a registered nurse as well. GoodShape.com, by the way, the website for this one, if you want to get more information about the work that they do and more on the Workforce Health Report, goodshape.com for that one. I started off by talking to Suzanne about the scale of this as a report and the sheer size of the problem that workplaces are facing.
I think mental health has been a problem for as long as I've been in occupational health, which is nearly 30 years. And it was here long before COVID. And, the data is the evidence now that we need to do something. And a good example of that is that 54% of people who have had 2 spells of mental health absence are more likely to leave the business. Now, that tells me and management that we should be looking at that first spell. That's when we need to be implementing the best support.
So on those stats, I mean, if you asked any person on the street, what is the number one reason why people took time off work in the year 2020, 2021? Everybody would say COVID. Everybody would guess it must have been COVID. Everybody. And yet it was mental health, and it was significantly higher in terms of mental health, 19%. Versus COVID, 16%. So this wasn't just neck or mental health has snuck in there. This was the number one reason by a margin, at huge cost to employees. I think it's been factored in at potentially £43 billion. And when people talk about, and I laugh now when people talk about this mental health time bomb, this idea that there's mental health is a problem we're going to have to deal with in the future. This is the evidence that it is here now. Businesses are having to deal with it now. People like yourself have got the stats, you've got the facts. It's an issue for our workplaces today.
Yes, I mean, ultimately, this has given me all of the evidence to be able to talk with authority. And I think we've always done what we've always done, and we're expecting a different result. And some of us are guessing as to what is actually happening out there. And when you say, asking the person on the street, they are going to say COVID. But therefore, it's the hidden part, isn't it? It's what's below the iceberg. And what's below the iceberg is the mental health issue. And what's been really interesting from our stats and data is it shows that once 1 in 12 people who've had a COVID absence will go on and have a mental health absence. And then you will see that the mental health absence is much longer than the COVID absence. The average for a COVID absence is about 16 days, but the average for a mental health absence is almost 19 days. So that's something we've got to factor in now as well. Mental health has been an issue a long time before we had this pandemic. And unfortunately, COVID is actually adding to the problem. In particular, different sectors. And we look at the NHS and they are just so overwhelmed with mental health, and when we think of our doctors and nurses who we have never needed more, and we're not actually looking after their mental health and their well-being as significantly as we should.
Yeah, and it's an interesting thing, isn't it? Because, of course, you'll have seen trends that have happened over those years that you've been working in this profession. And actually, COVID has obviously become a huge thing within, it gets disrupted a lot of those flow charts that you had that were sort of generally on a fairly steady path. But just to put it into perspective, even though percentages will change as a result of COVID appearing on the scene, the sheer number of days lost as a result of mental health problems within a workforce has continued to rise, and I guess we could say exacerbated potentially by some of the factors around COVID-19.
Yes, exactly. And also I see those figures rising in the future because we are not out of the pandemic yet. Then we are suffering with things like long COVID, and long COVID brings its own issues with cognitive behaviour psychological symptoms as well. We've got over 1 million people reporting, self-symptoms of long COVID. That adds to the problem. You've got the original mental health problems, which if we hadn't had COVID would still be absolutely massive. The NHS is under-resourced, so they're not coping particularly well with the COVID numbers. Other sectors such as councils, transport, logistics, they're all suffering with exactly the same thing, and just can't see any light at the end of the tunnel, with the staff that aren't at work at the moment.
So I guess, Suzanne, people will say, and businesses will say, okay, so what are we going to do? Because we've sort of circled around the edge of mental health first aid training potentially, or we've looked at it, or we had a couple of people who did a bit of training, then one of them left the company, and the other one's needs a refresher. They'll feel, and then actually, if COVID is going to go away, then maybe we won't need them anymore. What should businesses really be doing? What's a strategy which is sustainable for a business that will see them over the course of the next few months and years beyond COVID and way into the future?
Well, I've heard and read some interesting articles recently from people suggesting a 10-point strategy that's really heavy and, so much work needs required. And then I've seen the other end of the scale where people are saying just learn to listen. And I think it's somewhere in between. And I think what's really important is to check your existing policies and your procedures. Perhaps introduce something as simple as a mental health return to work form, because when you're suffering with mental health, that does not fit your usual form. And for me, it's about empowering the line managers to have a really effective, supportive conversation, and that just doesn't fit the boxes of the normal return to work form. Review what you're doing, look at the data that you've got, compare it to the national statistics, ask your employees, is it working for you, what we're doing? And what do you think we could do to help? Start at the top, get your board to focus on this key issue. Research what the similar sectors in the UK are doing. Research what support is out there. There's a great, phenomenal amount of support. There was the Thriving to Work government report that was a few years ago now, and that was the one with the 10-point strategy. The CIPD are producing regular, if not sort of 6-monthly, annual how to manage mental health at work guidance, which is great. You actually touched on training for managers, and this is a bugbear of mine, because it's not a tick box. You can't just show a video and have a half an hour chat. For me, it needs to be maintained. It's a program of training. You need to do awareness training. You need to do how to support someone training. You need to do how to have a conversation training. It's a much bigger program. And you've got to look at getting through all of your line managers and all of your team. And then there's the training for the employees themselves, because it's about recognizing stress in yourself and what your symptoms are, because we all know you just battle on, don't you? And then suddenly you completely crash. And if you'd known what the signs were to look out before, that would have added to you getting some help and seeking some support.
I guess as well, Suzanne, that for the sort of the hard-headed business manager, whoever he or she is looking at those stats and the figures. But we're essentially talking about people. But I guess as well, you're in a business where you're talking about the bottom line as well, whereby the idea of not investing now because you think it's not something you can really have to deal with, or it just seems a little bit, up in the air. Is it really an issue? Fine, we'll do our first aid training, but we don't need to do any more than that. Actually, an investment in something like mental health for a workplace. I mean, the benefits, I think we've talked about this from day one of the podcast, have been there to see in terms of staff retention, staff well-being, fewer sick days, all the just I guess that's about efficiency. It improves as well. Productivity, I guess, improves as well if you've got a healthy and happy set of staff. And businesses should know that, shouldn't they? They should be looking to act on that.
Absolutely. And the name of our company that I work for is GoodShape. And we feel that, if your employees are in good shape, then your organization is going to be in good shape. And it all starts with looking after their well-being, which includes mental health, of course, but includes other areas, of their lifestyle and health and maintaining good health. And if you invest in the well-being, it will improve their performance, because other areas we need to look at are things like presenteeism, for people actually working through their mental health problems at work without seeking the right support. And if you're working with presenteeism, you're underperforming, and therefore that's affecting the business and the bottom line. So when I say absence costs the UK billions, what about the other issues that are actually still going in the workplace? You need to add all of that in as well. And it's just this huge, massive problem that I think we're just not doing enough for.
Do you think as well that because, I don't know, we mentioned tick box exercising before, over, you do a course and everyone ticks the box to say they've done the course and you sign it off, and it's like, all right, we'll refresh in 6 months or a year's time. There's actually something that's much more human around this sort of conversation. It's about going into work, being valued. When you're having a good day, someone will recognize that in you. If you've been having a bad week or a bad month, that someone would actually value you enough to pull you to one side and check that you're okay, or notice that maybe you're not performing in whatever it is that you're doing, whatever environment that is, and say, is everything okay at the moment? And also not just have the question, but also an answer and a strategy in place as well. And that's a very human thing that I guess we need to teach people. But I always get a sense in the mental health world that that's the place we need to get to, that this is a much more human response to something which would traditionally have been dealt with by, bringing in someone from the outside or bringing in, a third party. We need to embrace that human side of things in ourselves, don't we, a little bit? And that maybe is a little bit different to the way we've done things in the past. And I wonder whether or not that's why potentially people are a little bit less minded to go for it, because it feels like you're being a bit too touchy-feely, that you can't. Being nice to people doesn't make you money, does it? And I think the answer is maybe yes, it does.
I think you're right. I think my team of nurses that I work with, even they find having a mental health conversation about how somebody is feeling, they find that the most challenging conversation that they have. Now, if you imagine a very new team leader or someone who just doesn't have a lot of experience or skills, if a nurse is struggling with that conversation, can you imagine how they feel about saying, and how are you? And how do you feel? It's a really difficult conversation, and we just need to give them the tools to actually sit, as you say, two humans together, just saying, how do you feel? How are you? And I just encourage people to say, how are you once? And then how are you again? And I've actually seen the adverts on the telly at the moment, which I just think is really great, because it just shows two people having a real conversation, an honest conversation, because it's so easy when someone says, how are you, to say I'm fine. But if we do ask this, and on a regular basis as well, don't just ask once and then move on, then I actually feel, like you say, we're just checking up and seeing how our team is, how our managers are. Sometimes I ask my manager, how are you today? And she looks at me and someone's saying, how are you? Because it works both ways, doesn't it?
No, absolutely it does as well. And do you think as well, potentially, and this is what we don't know, Suzanne, but we've got obviously such strong figures that show now that mental health is the number one reason for staff absences. Do you think as well that potentially there will still be people who ring up their line manager and says, I can't come in today because, and they'll blame some of the other issues, muscular, skeletal was one of the issues as well, I think gastro issues as well, that actually some of those will be mentioned as I need to come up with a physical reason that I can't come in, because I don't have the words to describe why it is that I can't come into work for mental health reasons.
And I do think that can actually be an honest reason, because mental health issues can cause both psychological and physiological symptoms. Sometimes we get people ringing into our service centre who have had persistent headaches, for a couple of years. And it's really important to say, you're getting a lot of headaches. What do you think might be triggering that? Similarly, upset stomachs, that's a really common side effect of stress and anxiety. And also managers need to be looking at things like behaviour and performance. Is somebody actually looking more irritable? Is somebody not performing like they used to do? So all of this is much bigger than just saying, yes, I'm suffering today with stress. You could actually have that headache. You could have that upset stomach, and you could be late for work. And if you actually look holistically at the whole picture, suddenly you realise what's going on with this person, and then that they need some early intervention, that they need some support. You may have an EAP program. You may have occupational health. You may even have physiotherapy, because you were saying musculoskeletal or long-term chronic sick causes one of the biggest stressors that I'm aware of, suffering with pain. So you get them physio, you get them the treatment. They actually then may be able to look after their own mental health as well, and return to health, and then of course back to health, back to work. So
do we need, Suzanne, down the line, let's get it up and running as soon as we can, do we need almost like a kite mark around sort of businesses, do you think, that almost staff, when they go into a business, of course, do you have any questions? The question normally is, how much are you going to pay me? And that's the sort of deal you do, don't you? Whether you pay me and I'll come into work. But it would be helpful, wouldn't it, if, you were applying for a job and this business was rated as an A-rated mental health business, that it was a B rating because of X, Y, and Z, and has been advised to improve on A, B, or C. That you could go into a business and actually get a sense of workload, stress management, because almost independently it had been assessed, and an independent voice, or even from the bottom up staff, had said this is the sort of company it is to work for. I've read examples recently of mental health organizations that have had negative mental health consequences for some of their staff, and you think, well, surely they should be getting it right, and that's not always the case. But we need to know that, don't we? In the same way we'd like to know about their first aid strategy or their holiday strategy or whatever it would be around childcare or anything else in between.
Well, you go to a hospital, an NHS hospital, and you can read the CQC standards, which means they've been graded as red, amber, or green. And I've always thought about the gold, silver, and bronze level of mental health support within a workplace. But I'm really glad you've asked this, because they've just brought in a new standard, which is the ISO 180450003.
It needs a catchier name than that, I think, Suzanne, doesn't it?
I think so too. But that does mean that you would have to pay for this standard, and they would come in and inspect your strategy and actually ask your employees, do you know about it? Have you been told? Have they been open and transparent with you about what's going on? Is it working? Do you think it's working? Could they do better? It's very new. It's early days. And as you've already heard, tick boxing is one of my bugbears, but I do think it's a really good start, because I want to see all organisations actually applying for this standard and having to provide the evidence, which includes the data, of course, about what they can actually do within their organisation to help people at work.
Absolutely. Suzanne, my own organisation's been backing the Where's Your Head At campaign, which has been campaigning for mental health first aiders in all workplaces and in colleges as well for young people, which is slowly making its way through the parliamentary process. And it strikes me as a good starting point, but very much requires those organisations, those businesses, to engage with it and see the benefit. And I'm hoping through a conversation like this one we're having today, that they will see that the benefits are absolutely front and center. These aren't some sort of flimsy benefits around the edges, which are nice to have. These are core central benefits to your business now and in the future.
Well, I've been saying for years that absolutely mental health first aiders should be a legal requirement. And I've been speaking with our MP from Watford, Dean, and he's putting it forward through Parliament, which is fantastic. I've always said, where you have a list of first aiders in your department, right next door should be your list of mental health first aiders, because these are our people at work that are trained and are experts in listening, which is the toughest skill of all. And they go through a course, and I think something leads them to actually want to do this role. These are going to be caring, empathetic, supportive people in the first place. And these people are absolutely essential. The employees need to know what their role is, how to use them, that they're completely confidential. They need to have places where they can have a comfortable conversation. And they just need to have the backing of the most senior members of the team. It's important to debrief them as a team. I'd love to see mental health first aiders having a monthly meeting, which could include refresher training and support for themselves. And then I think it's important for them to know where to signpost, so they have access to all of the local information, Citizens Advice Bureau, the telephone number for Mind, where you live, just all of this to hand. And if you've got a team of professionals all doing that in your workplace, I think that's a fantastic step. for supporting your employees. I know that EAPs, employee assistance programs, they're underutilized. But if you can actually just know that there's somebody in your department that will keep everything you want to talk about completely confidential, you're going to go and see them, aren't you?
Absolutely.
I think it's fantastic, and it gets 100% gets my vote. So
excellent stuff. And I guess as well, this is an important thing too, that sometimes if you are a boss, a manager, and you're suddenly thinking, oh, this is something else I'm going to have to deal with. Maybe you could give us, Suzanne, a couple of examples of things that you change within workforces or changes that workforces have made, because I'm guessing some will be very, very slight around, I don't know, allowing someone a slightly different start or end time because it helps them with some caring responsibilities. That sometimes if you make an intervention, that you're going to suddenly have to provide X, Y, or Z for it. But I'm guessing some of the things you've actually dealt with within the work you've done over the years gives you a sense that actually it doesn't need to be, a life-changing or business-changing things, that the small differences can make a real big difference.
Yeah. And I just think I hear the managers complain, there's a lack of time, there's a lack of resource, we're not trained to deal with that. And for me, they're the first things is make time, find the resource, find the rooms, find the training ability, put some money in your wellbeing pot to focus on the key area. We can prove with our report that the key area is mental health. So if you actually put that into your bucket and actually put the appropriate amount of funds and resources into there, you will get a positive response. You need to train your line managers. You need to train your employees so that they recognise it themselves. Make your employees feel confident that change will be made, because they're so concerned about saying, I've got a mental health problem and nobody's going to do anything about it. And that's a problem that we've seen in some organisations, is they don't really recognise it's such a big problem. And then, of course, there's the lack of engagement. Employees don't feel valued. They don't understand the changes that are going on at work. So I think communication and being clear is super important. And then the last thing I always say is talk, keep talking, keep asking. At every opportunity, at one-to-ones, at lunch. I mean, we're all working from home now. That's a massive difference from 2 years ago. So it's important to make sure you have a Zoom meeting like we're having, or you have a Teams meeting with your team on a regular basis. Just the first thing you should say is, how are you? What have you been doing? Happy New Year. We've done all that today. It's really important, because mental health is number one. It's the priority.
I still think that sometimes you still see, businesses on social media, Facebook, LinkedIn, whatever it is, and the manager that says, right, nobody's allowed to answer any emails between 6 p.m. and 6 a.m. And they're lauded as these forward-thinking, like, oh, look at these, what a boss! I'd love to work for this guy or this woman. And you think that should be standard, normal practice. You wouldn't be taking work calls on your mobile phone, processing orders for a factory from your kitchen. Maybe some have from working from home, and sometimes the lines have been blurred a little bit. But actually, those things which I think are seen as outlandish or sort of slightly radical, I think could and should become normal very quickly for a lot of businesses. And I think they would reap the benefits, wouldn't they? Because nobody wants to be working at 9:45. Watch some depressing news headlines at 10 o'clock, go to bed, and then be checking their emails before they get in bed, and then check their emails again at 6:30 a.m. when the alarm goes off. That's no way to live for anyone, is it?
I mean, this is a very serious thing, but I know of some managers that will send an email as late as possible to try and outdo the other manager that they're sending the email to. And I think that's really irresponsible, because they're actually in competition and making the situation worse. I feel obviously the employer has some responsibility themselves not to work and to have, do their own timekeeping and all of that. I think if you're working that late, you obviously feel under pressure, and something is wrong with the control that you've got over your own workload, because you wouldn't work. No, like you've just said, nobody would work that late if they didn't have to. So they obviously feel that there's too much workload, and that needs to be looked at. But it's about being honest, isn't it? Saying to your manager, I found myself working beyond 6 o'clock last night. Can you help me to look at my priorities? Is there anything I could drop off the bottom? Could we put it back to another time? What are your deadlines? What are your objectives? You've got to start with that conversation before you blame yourself in any way, shape or form.
Yeah, absolutely. And I guess as well, when you have these conversations, if you were talking about a delivery of a project, you would talk about the things that are going to go right, the things that are going to go wrong, the things that are potential problems. But we almost see it as a weakness, don't we, in ourselves, if we have to say one of the problems might be this is far too much for me to have to deal with, or I've got some major thing that's coming up which is going to be disruptive at some point, the week before delivery. But actually, if we were empowered to be able to talk about that, and the boss was understanding of that, then straight away that would be built into the strategy in the same way it would be built into the strategy if there was going to be a major road closure, outside your factory 2 days before you're opening, or something along those lines. You'd build it in, wouldn't you?
And I think that's what makes good leaders over, managers, because the managers are too focused on the higher level of all of these activities, where a good leader would understand where the loopholes are, where the issues might be, and just say to you, right, well, that's a problem. Let's work on it together. And how can we fix that? Because then if my manager said that to me, I would just feel so much more comfortable the next time saying, there's too much. What do I need to do first? Can you help me just with my priorities? And it makes me so sad that there are good and bad managers. And how is that right? We should all have the same manager, the same consistency of care and support throughout the organisation, to encourage people to talk. I mean, it used to be that men found it really hard to say, I'm not coping, I don't feel well, I feel sad. I mean, how difficult is it to say, I feel sad to your manager at work? Whereas if you've got a good leader that you've got a great relationship already, may already see, you look really down today, are you okay? And you can open up. And that's what I want to see in the future.
Absolutely. In terms of things moving forward, some of the industries that have been most adversely affected, construction, we've talked about on the podcast many times because of the issues there. Transport and logistics is also high on those. Yes. But the number one is actually government and government departments, which gives you a sense that if something is going to change from the top, they should know all about it, because there will be leaders and managers within those departments who are going, yeah, I know, I'm literally having to deal with this on a daily basis.
My worry is that they are probably more stressed themselves without being able to admit it than anybody else, and that they are so busy that they haven't had the time or the resource to actually help themselves. And we were saying earlier, weren't we? If you've got a high level of stress in your own organisation, you should be the ones that are the best at doing it, because they've got the data at their fingertips. And it's really shocking that they've come up so high. And if we start with them and they actually build in a really good strategy, they could share that with everybody else as best practice. And that's why I think it's really important to get all the different sectors together, on a regular basis. Just because you're a business doesn't mean you can not talk to another business and see what they're doing, what works for them. Can we implement that in ourselves? And I think the government is a closed shop in that area.
Is there a magic bullet? You mentioned the work of Dean Russell, the MP who's been on the programme, one of our Where's Your Head At ambassadors as well now, because of the work that he's pushing through. Is there a magic bullet? Is there one change that we can all sort of work on together that can ensure that the information contained within your report is acknowledged and then seen as a priority that will aid not just the humans that we have operating in society, but businesses and therefore the economy in the long run too?
There is no magic wand, but the one thing I would say is what's wrong in your organisation. Find out what the real picture is. Don't guess. Don't keep doing the same things. Find out what your data is. Look at your absence, your presenteeism, your lifestyle, your profiling. Check what's going on, and then make sure that your solution and the things that you're going to implement are around those key areas. And just an example of that is we worked with a very large retailer, and they set up an EAP, and they were very concerned about the mental health problems. And actually, once they looked at their real live data, they found out that people were suffering with financial issues. So they reduced the amount of money they were putting into their EAP and introduced a fantastic financial company who would help people at when they were actually given their wages. So it would be taken out before they ever saw it, and they saw a huge increase in better well-being. For me, it's about what's the problem and finding the most appropriate solution. If that's the one tip I can leave people with today, is find out, use your data.
Absolutely. And GoodShape, by the way, I'll put links on the podcast right up where people can see some of the work they've done. Read the full report as well, because there'll be plenty of business leaders who've been listening to this, Suzanne, who are suddenly going, "Oh, right, okay, we've looked at this. We probably need to look at it again and be really on top of it." But quite clearly, from everything that we've said, this I don't like to just bring it down to money, but it pays for itself in many different ways.
It does. It exactly does. If you invest now in your people, you're going to improve well-being, and just intrinsically you'll improve performance and therefore productivity. As I said, if your people are in good shape, your business will be in good shape. And we talk about it all day, every day, and I hope that's come over.
Absolutely. Suzanne Marshall, Clinical Governance Officer for GoodShape, also a registered nurse as well. And the UK PLC 2021 Workforce Health Report is out now. Thank you for joining us on Mental Health Monday.
Thank you for having me.
I hope you've enjoyed this week's podcast. Thanks for checking out Mental Health Monday. My name is Mick Coyle. You can find me on Twitter at Mr. Mick Coyle. You can also find me, Mick Coyle, on Facebook as well. Don't forget, if you want to speak to somebody about your mental health, you can do so. The Samaritans, free to call on 116 123. You can find mental health services where you are. Just look for the Hub of Hope. Type in your postcode. It'll find those mental health services close to you. And for support in a crisis, you can text SHOUT to 85258. That's if you're experiencing a personal crisis, you're unable to cope and need support. Shout to 85258. That's a text line. Do get involved in those services. In an absolute emergency, always remember the number to call is 999. Thanks for downloading the podcast this week. We'll be back next week with more Mental Health Monday.